Is it possible to have symptoms of pregnancy with twins but a negative pregnancy test result?
Hello and welcome to our discussion on twin pregnancy symptoms and pregnancy tests. This topic can be a bit confusing, but we'll break it down step by step. The question we'll tackle today is it possible to have symptoms of pregnancy with twins but a negative pregnancy test result? This is an intriguing scenario that's worth understanding better.
What are pregnancy symptoms?
Before we delve into the specifics, let's first understand what pregnancy symptoms are. These are physical or emotional changes that can occur in a woman's body shortly after conception. Symptoms can include missed periods, breast tenderness, nausea, also known as morning sickness, frequent urination, fatigue, mood swings, and others. Some women might experience these symptoms as early as a week or two after conception.
Symptoms of twin pregnancy.
Now, in the case of a twin pregnancy, the symptoms can be the same, but often they are more pronounced. The reason is that with two babies, there's more hormonal changes happening in the body. Hence, symptoms like nausea, fatigue, and breast tenderness can be more intense than in a single pregnancy. Some research even suggests that women pregnant with twins can experience early and more frequent fetal movement. But remember, symptoms can vary greatly from woman to woman, and having more intense symptoms does not necessarily mean you're having twins.
How do pregnancy tests work?
Pregnancy tests work by detecting a hormone called human chorionic gonadotropin, HCG, in your urine. This hormone is produced in the body after the fertilized egg attaches to the uterine lining, a process that happens about a week or so after conception. The HCG levels in the body then continue to rise rapidly, doubling about every 2 to 3 days.
Can you have twin pregnancy symptoms and a negative pregnancy test?
Here we arrive at our main question. You might think that with the increased hormonal changes in a twin pregnancy, the pregnancy test would show a positive result sooner. However, this is not the case. It's important to understand that pregnancy tests can only detect pregnancy after HCG levels reach a certain threshold, and this happens around the same time regardless of whether you're pregnant with one baby or two. Therefore, if you take a test too early, before your body has produced enough HCG, it could show a negative result, even if you are pregnant, and even if you're having symptoms. It's also worth mentioning that there are other conditions, like hormonal imbalances, that can mimic pregnancy symptoms. In conclusion, it's indeed possible to experience symptoms of pregnancy, even more pronounced ones like those often associated with twin pregnancies, and still receive a negative result on a pregnancy test. This usually means the test was taken too early, before HCG levels reach the detectable threshold. If you're experiencing pregnancy symptoms but have received a negative test result, it might be a good idea to wait a few days and test again, or consult a healthcare provider. We hope this discussion has been helpful. Remember, every woman's body and every pregnancy is unique. It's important to listen to your body and seek medical advice when necessary.